Welcome to Tuesday's edition of COVID-19. Korea's daily tally appears to be holding steady on the 300 level today, with a further, albeit slight decline from Monday's figure. Meanwhile, efforts are underway to allow for a sense of normality within the academic arena, and we have details on that later on the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, So-ah, we're marking a second day of cases on the 300 level here in Korea.
Yes, we are, Sunny, and we're also seeing a decline in the COVID-19 infections this Tuesday, which have dropped to 374 as of 12 a.m. And that includes 347 domestic transmissions, so that number now below 350. So the daily caseload has been in the 300s for the second straight day, as Sunny said. So we are seeing a downward trend recently. And if we go closer to our map now, there's been a slight rise in the greater Seoul area, but in overall there's been a decline outside the metropolitan region. And with that, the number of cases here in the country stands at 148,647. We've also got 4 additional fatalities, raising the death toll to 1,992.
I see. So what is the latest on the local vaccination front, where officials, I understand, are seeking to reach all corners of the country?
Right, Sunny. And to do that, those people will be soon included in these numbers here. We've got 12.5 million people who have received at least 1 dose of vaccine, and also over 3.2 million have been fully vaccinated. So that also includes the people who've got inoculated with the Janssen vaccine, which only needs 1 shot. And as Sunny mentioned, vaccinations have also begun for people living in difficult to reach places, such as remote islands, with vaccines even being administered aboard ships. Since Monday, Navy vessels have been dispatched as part of a 2-week vaccination program for people on 25 islands and 3 cities and counties in Jeollanam-do province. Around 600 residents are to receive the Johnson & Johnson's Janssen vaccine due to the convenience of being a single-dose vaccine. And on to other vaccine-related news. Novavax has shown over 90% efficacy in a phase 3 clinical trial, and the Pfizer and AstraZeneca vaccines in a study were highly affected against the Delta variant after 2 doses, which also earlier was known as the Indian variant. Now, the World Health Organization, meanwhile, welcomed the G7's recent pledge to inoculate the entire world, but says vaccines need to be rolled out faster.
I welcome the support expressed by the G7 for WHO, the ACT Accelerator, and the idea of a treaty on pandemic preparedness and response. And I welcome the announcement that G7 countries will donate 870 million vaccine doses, primarily through COVAX. This is a big help, but we need more, and we need them faster.
And that as the world is still reporting over 311,000 infections in just a day, with the total number standing at 177 million. We've also got over 8,000 new fatalities. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, So thank you for now. Right, meanwhile, President Moon Jae-in is in Vienna for a state visit ahead of the 130th anniversary of diplomatic ties between Korea and Austria next year. For more on this, I have our Kim Dami here in the studio with me. Welcome, Dami.
Good afternoon, Sunny.
Right, now I understand there was quite a bit of media attention in Austria on Korea's COVID-19 strategy.
That's right, Sunny. So during a state visit to Austria, President Moon shared Korea's experience in tackling the virus with the members of the gathered press. Let's take a listen.
Korea is a world leader in the fight against the COVID-19 pandemic. What can Austria learn from Korea?
So Austria's Chancellor Sebastian Kurz also took the opportunity to praise Korea's effective use of technology and data to keep the coronavirus under control.
Korea's application of technology and information far exceeds what countries in Europe thought was possible.
President Moon also highlighted the importance of trusting science and deferring to the experts while setting aside political considerations when it comes to prevention and vaccinations. Moon credited the nation's people for their voluntary participation in containment efforts, like their compliance to mask-wearing rules. He also called for the further use of information technology to fight the pandemic while also adopting data privacy regulations at the same time.
I see, and I hear he also voiced hopes for Korea to share COVID-19 vaccines with North Korea.
That's right. So President Moon also said that Korea is working to donate vaccines to North Korea if the regime agrees. Take a listen.
한국이 글로벌 생산 허브의 역할을 할 경우에 북한도 당연히 협력 대상이 됩니다. 북한이 동의한다면 북한의 그 백신 공급을 협력하는 것을 적극적으로 추진하겠습니다.
He also added that the U.S. is backing humanitarian aid efforts for North Korea. The South Korean leader said the only way for the world to overcome the pandemic is to distribute vaccines equally to developing and underdeveloped countries. The Austrian leader expressed his country's willingness to help if the North signals that it's willing to receive aid.
Right, Tammy. Meanwhile, here on the domestic front, Korea's goal of offering the first dose or one dose of the COVID-19 vaccine to 13 million people within the first half of 2021 may be reached, I understand, earlier than scheduled.
Right, Sunny. So Korea is so close to reaching that 13 million mark. And actually, it might happen on this Tuesday. And if we do pass that milestone this week, that would put us 2 weeks ahead of schedule in our vaccination timeline.
Around 12.5 million people have gotten their first doses as of 12 a.m. Tuesday. They represent a quarter of our entire population, and that figure is likely to top 13 million, either sometime today or tomorrow at the latest.
The country's inoculation program is expected to pick up even more steam as it begins to vaccinate people in younger age brackets. Starting this week, medical workers under 30 at Tier 1 hospitals will get the Moderna shots, which arrived in Korea earlier this month. Also, people aged 75 or above will get their second Pfizer shots over the next 3 weeks.
Right, Tammy, finally, do tell us a bit about the protocols that permit an exemption from the self-isolation period upon arrival from overseas.
So travelers are required to submit specific documents, including proof of vaccination and a family certificate of family relations. Applications must be sent at least 7 days before departure, and travelers must be fully vaccinated. And if they receive 2 shots, they must have been administered in the same country. The exemption will apply to Korean citizens or foreigners who are visiting to see their spouses, parents, or children, but siblings and distant family members don't apply. And those who are traveling on important business purposes or state functions will also be exempt. Now, as of Monday, travelers from Brazil, South Africa, and 11 other countries will still need to be in 2-week quarantine due to concerns over variants. And all travelers, even those exempt, will need to test negative for COVID-19 3 times, 72 hours prior to departure on the day of arrival and 7 days after arrival.
All right, Tammy, as always, thank you very much for the coverage.
My pleasure.
Right, we are poised to join the regular briefing on the COVID-19 situation here in Korea for this Tuesday. And while we wait for that to start, let's take a look at the incentives for those who have received at least 1 dose of the COVID-19 vaccine and have witnessed the passing of 2 weeks. First, these individuals are excluded from the cap of 8 people for immediate family gatherings. Now, this means any family member who has received at least 1 dose at least 2 weeks prior will be exempted from the head count of 8 people for family events. Secondly, access to senior welfare and activity centres is allowed. Also, for those fully vaccinated, recreational programs such as singing classes is permitted, as is the sharing of meals. And in-person visits to nursing homes is possible if one party is fully vaccinated. However, at nursing homes where the vaccination rate for the first dose stands at below 75%, a negative PCR test will also be required. Prior reservations are necessary and no eating nor drinking is allowed during these face-to-face meetings at nursing homes. What's more, face masks remain mandatory. Meanwhile, those fully vaccinated and working at high-risk facilities such as nursing homes will also be exempted from the regular testing requirement. The briefing's about to start. We'll come back to you afterwards.
네, I am head of the epidemiological investigation team, and let us now begin our regular briefing for June 15th, Tuesday. First of all, here are some updates on the COVID-19 vaccination front. As of today midnight, we have surpassed over 12,565,000 number of people when it comes to the number of people who have received at least one dose of COVID-19 vaccine. And as of yesterday, we also see that as of today afternoon, we believe that we are going to be able to reach our milestone of 13 million, which was our initial goal for the first half of this year. And I would like to extend my deepest appreciation to the members of the public for your participation and also for your trust in the government. And my thanks also goes out to many public officers as well as healthcare providers and also other staff members who are making this possible right now. And in Q2, as for those under the age of 30, the Pfizer vaccine rollout has begun. And the eligible recipients are those under the age of 30, and they include essential social workers, including police officers and firefighters, as well as healthcare providers, and also the healthcare providers and teachers who are taking care of children under the age of 9. And to this end, in just 2 days after we received the booking for the vaccines, the booking has been completed. And to this end, there have been people who were not able to make their vaccine appointments. And going forward, we will also begin our another process of the vaccine appointment booking process starting from the 28th to the 30th. And we will be rolling out additional vaccines starting from July as well. And as for Q3, we will also receive our booking process for the eligible recipients. And we believe that in the latter half of this year, we will be having a more diverse choice when it comes to the vaccines available here in Korea. And to this end, we will also have a multi-vaccine supply here in Korea as well. And to this end, as for AstraZeneca, Janssen, Pfizer, Moderna, and we believe that these types people would be able to pick from these types of vaccines, and we will also be fully paired so that we can roll out the vaccines for eligible recipients in Q3. And starting from today, for the next 3 weeks, we have our data system, and we will be looking into and investigate the vaccine types and supplies at each of the designated hospitals. And as for these hospitals, we will be looking at the storage areas as well as the area for restings for these people who will be getting vaccinated there. And we will be inspecting those detailed specs as well. And we will also make sure that we have no vaccine administration error. And we will also look into these training and education, which will not become mandatory for those hospitals that roll out the vaccines. And the hospitals will also cooperate fully with the quarantine authorities, and we will also watch in full-fledged so that there are no mistakes going forward. And here are also our updates on the vaccine supply front. As for the supply, the Pfizer vaccines, we have about 550,000 vaccines doses to be arrived in Incheon International Airport very soon. And as for Pfizer vaccine, 7 million of them that are scheduled to come in the first half of this year. We will complete the process for about 5.7 million, and the rest will also be provided to Korea as well. And as for the senior citizens, which were the priority group of the vaccinations here in South Korea, we are seeing a major decline in the number of infections and the number of fatalities. And as for these infections among these groups of people, out of every 100,000 people, we had about 18 infections in early this year. However, we are seeing this decline to about 2 2.3 in June. And as we have the vaccination rate increasing for senior citizens, we are seeing a very clear and visible effect when it comes to the decrease in the number of infections. And as for these senior aged people, we are seeing also a decline in the number of fatality rate as well. And we believe that overall fatality rate will also decline going forward. And recently we had private cram schools which were the subject to the latest cluster infections. And here are some details. And after this January, we have about 50 cluster infections breaking out at cram schools. And there were about 1,060 people who were infected. And we see that there were also one of the risk factors being congested areas, and they had poor ventilation. And also at one cram school, one person was infected, and this person spread the virus to about 36 others within one cram school. And when we look at this case, we see that this index case has had a delay in identifying the COVID-19, and this person also stayed at this cram school, which was a small area and also had poor ventilation for a very long time. And we also carried out our simulation of the travel of the air droplets, and we see that within even 30 seconds, we saw that the droplets have traveled all across the room. And when it comes to using these multi-use facilities that are indoor spaces, it is very crucial that we have regular ventilation and proper ventilation. And as for the managers and also the workers who are working at these at the multi-use facilities, that is, we ask you to open the windows and also have regular ventilations and also natural flow of air. And if you have any clinical symptoms of COVID-19, please do not go to these facilities. You shall get tested as soon as possible. And also when you are going to cram schools, please wear your face mask and also comply stringently with the quarantine measures as well. And also it is very essential that you ventilate the space, and when ventilating you need to open entirely the windows and doors for about 10 minutes. And as for the buildings that have the ventilation mechanisms, we ask you to operate this on a regular basis as well. And moreover, here are some updates on our new variants identified here in the country. And we are also bolstering our inspection for these new variants. And for the past week, we have been looking at about 15.5% of these targets. And we have identified 631 gene tests. And we have seen 226 new variants have been identified. And our rate of identification now stands at about 35.8%. And as of these new cases, 226, we see Alpha variant 190, and also one Gamma and 30 Delta variants have been identified. And among them, 31 were imported cases and 195 were local transmissions. And as for these local transmissions, we see that 35 were Gyeonggi province, 24 in Daegu, and 23 in the Chungbuk area. Moreover, starting from the May 4th, for the 18 rounds of flights, we have had our Korean nationals return from India, and more than 3,400 have returned. And so far, we identified 78 people who have been contracted with the virus, and 19 people have also been identified with the new variant. And as for the COVID-19, not just 1 year ago, it was a rare virus that we were not aware of. However, this has been with us for the past year or so. And lately, we are also seeing a wide spread of the new variant, especially the Delta variant stemming from India. And we believe that there are many concerns as well. And here are some updates on our scientific investigation. The Delta variant in particular has very high transmissibility. However, research in the UK shows shows that you can also have great efficacy and protection if you have 2 shots of the COVID-19 inoculation. If you are administered with 2 shots, we see that the efficacy rate of protection hovers between 60 to even 88%. And also we see that we can reduce the rate of hospitalization by over 92 and 96%. And to this end, we believe that the best aspect and the best means to protect ourselves against these new variants is to have yourself fully inoculated. And we believe that this is also becoming a new international norm. And going forward, we sincerely hope that we can also monitor and also manage the new variants with our inoculations. And we are also going to update you on these cautions that you need to take in after the inoculations. And you need to also have the passing of about 2 weeks after the inoculation in order to develop antibodies. And it is very crucial that you are vaccinated twice if the vaccine requires 2 doses. And also we believe that the herd immunity also will take some time for us to reach and achieve. And we believe that it is also very important that we do not take our guards down and we continue to exert our full efforts to continue to comply with the quarantine measures. We need to also have a combination of vaccine rollouts and the quarantine measures, and this can also help us to contain the virus as early as possible. So if you have any symptoms, please get tested. You need to wear your face mask and wash your hands on a regular basis as well. And we believe that earlier than scheduled, we will reach the milestone target of 13 million inoculations. And I want to extend my deepest appreciation to the members of the public. For the past year or so, we have learned a lot about the virus, and we are also navigating ways and wise ways to fight against the virus. We will also exert our full efforts.
기자님들 질의응답 시간 갖겠습니다.
Right, there was Lee Sang-won with Tuesday's afternoon briefing. So what did he have to say?
Well, he has expressed the government's confidence in reaching the goal of inoculating 13 million people with COVID-19 vaccines by the end of this, by the end of the first half of this year. And he said that's expected to happen this afternoon, this Tuesday afternoon. And he also mentioned how the vaccination for people aged below 30, when it comes to essential workers, has kicked off with the Pfizer vaccine. And people who haven't been able to register for that vaccination can do so from June 28th to the 30th. And he also said that there's been a clear decline in COVID-19 infections and fatalities among seniors, especially those aged 75 and above, because the vaccination completion rate in that age group is the highest. Also, let me give you some updates on variants. We've got 226 new variant cases with 31 imported cases and 195 local transmissions. And there's been quite a rise in the Delta variant as well. So that's also important why we have to get vaccinated, because 2 shots of either AstraZeneca or Pfizer vaccines does help in preventing even variant COVID-19 infections.
I see. All right, so thank you very much for that.
My pleasure.
Right, hopes are high for curtains to go up on most stages nationwide amid an ease in audience limits starting this week. Accordingly, in this next report, we bring you efforts by theatrical performers and related staff aimed at making sure the show goes on.
Broadway and the West End are back. After more than a year of darkness, theaters on the West End reopened in May, and many shows on Broadway are slated to return in September after an 18-month hiatus. But what about the performing arts scene here in Korea? The number of theatrical productions in Korea has fell around 35% on year, with revenues being cut nearly in half over the same period. Nevertheless, some theaters managed to continue holding live stage performances with rigorous prevention rules in place. Aid measures rolled out by the government also handed a lifeline to the performing arts industry in their desperate bid to survive.
공연 예술 산업 안에서는 사실은 그 연극인 복지재단이라고 있습니다. 거기에서 창작 지원금을 만들어서 지원한 거하고 그 외에는 다 이제 그 정부와 지자체에서 예술인들을 위해서 각 자치구별로 예술인 지원 사업이라고 있었고요. 또 문화재단에서 아주 소액의 그 개인 대상의 지원 사업이 있었습니다.
Although managing to avoid a complete shutdown, the performing arts industry is continuing to struggle under the weight of social distancing restrictions, one of which only allows venues to fill their seats to 70% of their capacity, which even then rarely, if ever, sell out. But these challenges have done little to deter the passion of the artists here, who are driven by the opportunity to continue doing what they love, no matter the sacrifice. Daeangno is Korea's Broadway, and it used to be filled with crowds of people looking to enjoy a night out at the theater. Here, a few shows have survived, including one on the subject of COVID-19. Actors and actresses are rehearsing for a play about a man who contracts the coronavirus. It is Korea's first ever theater production on the subject of the pandemic, depicting the story of a man, which begins after he is hospitalized for COVID-19.
엄마, 아버지! 놀라지 마세요. 저 코로나 확진이에요.
나도 내 주변에 함께했던 많은 사람들이 한꺼번에 걸렸어요.
This production is based on a true story of the theater troupe behind it, which had 15 of its members test positive for COVID-19, following a mass outbreak in August of last year.
함께 했던 동료들이 누구는 확진이 되고 또 누구는 저처럼 자가격리를 하고 음성이어서 그런데 2주 동안 방에 갇혀서 그 방 안에서만 생활을 하고 집에 있는 가족들에게도 굉장히 미안한 마음이 있었고 이 연극을 통해서 같이 힘내자, 잘 견딜 수 있을 거야, 지나갈 거야 그런 느낌으로 공연을 준비했습니다.
이동하고 마지막 대사를 거기서 해. 저희들 스스로에게도 이 공연을 통해서 좀 극복할 수 있었으면 하는 생각이고 오시는 관객분들도 뭐 두려워한다거나 그러시지 않으셨으면 좋겠어요. 충분히 극복할 수 있을 거라고 생각하고요. 그렇게 같이 이겨나갔으면 좋겠습니다.
Actors are taking to the stage here at another theater in Daeangno with strict disease prevention protocols in place.
특히 공연 업계 쪽은 관객들을 많이 모아놓고 해야지 그 첫 맛이 나기 때문에 그 느낌을 더 내려면 관객들이 많이 오셔야 되는데 저희도 또 열심히 준비했고 관객분들한테 그 양질의 공연을 또 보여드리고 그래야지 저희도 보람 느끼고 좋은데 요즘에 그럴 수가 없어가지고 굉장히 저희도 아쉽죠.
So what is it about the performing arts which continues to attract visitors despite the strict rules and other inconveniences that have become the norm at theater venues?
아무래도 공연을 보면 그냥 일상생활이나 이렇게 학교를 다니면서 좀 힘들었던 거를 조금 그래도 내려놓고 공연에 집중을 할 수 있게 되는 것 같고
공연이라는 것도 사실은 그 로컬 관객만이 아니라 또 공연의 특수성상 해외 관객들 또는 지역의 관객들이 같이 한 공간에 모이게 돼야 되는데 그러려면 이동도 자유로워야 하고 또 관광 산업도 다시 활성화가 돼야 되고 여러 가지 것들이 같이 연동돼서 움직이기 때문에요. 이러한 어려움들이 단시간 내에 회복되는 건 조금 어렵지 않을까라는 생각이 들고요.
코로나가 이제 백신 보급이 확대되면서 이제 곧 제자리를 찾지 않을까 이렇게 기대를 하고 내년쯤부터는 관객에 대한 제한이 없어지면서 그동안 축적된 이렇게 온라인 공연이 같이 접합이 돼서 새로운 형태가 등장하지 않을까 이렇게 기대를 하는 것입니다.
Art is a reflection of our hopes and dreams, and the artists here are carrying with them a message that expresses our collective yearning for a better tomorrow after the pandemic.
이 학기에는 전면 등교를 포함해서 등교 확대가 가능할 수 있도록 학교 밀집도와 같은 거리두기 단계별 지침을 방역 당국과 지속적으로 협의 중에 있습니다.
이번 주부터는 수도권의 중학교, 직업계고, 고등학교의 등교가 확대되며 방역 수칙이 완화됨에 따라 사람 간의 접촉이 늘어날 걸로 예상하고 있습니다.
The academic plan for this autumn here in Korea is the full resumption of in-person classes. Now, understandably, the plan has been received with a bit of public ambivalence. And for more on this, I have Professor Choi Young-jun from Korea University. Welcome back, Professor Choi.
Nice to have you here.
And joining the session virtually is Professor Cassandra Berry at Murdoch University over in Australia. It's a pleasure to have you with us, Professor Berry.
Good to be here. Thank you, Sunny.
Right, we'll start here in the studio then. Professor Choi, starting this week, as seen in the video, middle schools in the Greater Seoul area have opened their doors further to 2/3 of their student bodies. What are your thoughts on this further opening of school compounds, given our current COVID-19 situation?
So I think there are 2 points that we could discuss from here. First, although the numbers are still up there, we are facing a lot less of the severe cases or the patient who comes into critical care or even death. So that's all thanks to the vaccines. So that is one point. The other one is that 1 year after the COVID pandemic, almost all students are still affected by partial school closures or full school closures, and they fall below the minimum proficiency for the educational readings and mathematics, all result of the health crisis. So I think it's a fair policy that to address the current situation and the current needs.
Right. Professor Berry, I believe Australia, meanwhile, has been keeping the virus at bay with only a handful of new cases in recent days. Please do start by telling us a bit about the situation there, including the overall atmosphere within the academic arena in Australia.
Okay, yes, we have been very fortunate here in Australia. We have had no new cases in my state, in Western Australia, where I live in Perth. And Australia has only had 30,262 cases in total, with 910 deaths. So we are able to keep the virus suppressed in community transmission. Academically, though, we value our education. Our schools are open. There are very few restrictions. It is a state-by-state basis, though. Some states do have to have harder restrictions than others. But here in Perth, we have only had 2 very short snap lockdowns this year.
I see, that's quite fortunate. Meanwhile, Professor Choi, back here in Korea, how do you respond to concerns about COVID-19 contagion within congested classrooms?
So I think we could discuss about the trade-off between the medical standpoint and the educational benefits. So if we prioritize the values in each segment of the society, maybe the schools must probably come first compared to other places. So by prioritizing the educational recovery is quite crucial, we think, to avoid any other consequences. So we should probably weigh between the benefit and the cost of the current quarantine measures.
Right. Professor Berry, what are the prerequisites for in-person classes at schools in Australia?
Well, most students do attend in-class schools. At the university level, though, we have shifted to some modes of online learning, particularly since our international borders are closed. So we have on-campus and online as an alternative. What the state health departments are looking at is daily case numbers. So when we have that under control, our schools are basically open as normal.
I see. And what has been the response, Professor Berry, to online classes at the university level?
Mixed responses by both academics and also students. I think we've come a long way since last year, learning different digital technologies. And in some way, I think the detail is better with online learning. But of course, competencies and hands-on skills is better, face-to-face on campus.
I see. Meanwhile, Professor Choi, as part of efforts to better contain transmissions at schools, a few preemptive testing options are being explored here in the country. They include self-testing kits and the mobile testing units. What do you believe would be more effective at schools?
So there are some certain limitations to this rapid antigen test or the rapid PCR testing. Because of the predictive value is quite limited because of these intrinsic properties of the low sensitivity and specificity compared to the conventional testing. But the benefit from it is that you can add to the power by expanding to the more students to get tested. So balancing the weight between the risk of using it and understanding the testing result and probably giving the benefit from the expanding the test would be, we could probably make the balance between the two.
Right, and staying with prevention efforts on the academic front, Professor Berry, what are some safety measures in place at schools in Australia then?
Well, if a child has any symptoms of illness, they need to get a COVID test and they need to go home and self-isolate whilst those test results return. If they are positive, they need to quarantine or self-isolate for 14 days. But we've been very fortunate that we haven't had a virus outbreak at a school in Australia yet.
I see, and I hope that continues to be the reality, of course. Now, elsewhere in Asia, authorities in the Philippines are fighting an outbreak that has been aggravated by the presence of variants. For more on this, I have Professor Jerome Cleopas at De La Salle University in the Philippines. Welcome, Professor Cleopas.
Thank you very much for inviting me.
Right, Professor, let's start with the COVID-19 situation there and its impact on the education sector then.
Well, currently we have 1.32 million cases and about 22,000 deaths as of today. And then we are averaging about 6,430 cases in the last 7 days. Majority of the nation is still on lockdown, and specifically in Metro Manila, which is the city capital, has been in various levels of quarantine since the beginning of the pandemic in March 2020. In terms of vaccination rates, we have around 1.6 million or around 1.5% of the population that has been fully vaccinated, and around 2 to 3 million who at least got their first doses. And then we are still, of course, observing social distancing measures and preventive measures such as wearing face masks and face shields. In terms of education, according to the report of the Department of Education, there in the K-12 program, there are a total of 24 million enrollees in the recently concluded academic year, because we are currently on a term break right now. And then 20 million of those 24 million are from public schools. And since we are still mostly on lockdown, most of our modes for learning is distance learning. Some would opt to go for full online learning, where they go and do it through learning management systems. And there are those that, for areas where there's poor internet coverage, the DepEd TV, or the Department of Education, uses broadcast media to be able to provide education. And then there are printed modules that they could use in order for them to, and then they cooperate with their parents for them to be able to do these educational modules. In terms of the activities being done by the government, in terms of capacitating teachers, they have done that, but a bit too gradually. So we've seen efforts from the Department of Education, the Commission of Higher Education, national government and national and local government agencies, the private sectors, and by the educational institutions as well. And at the moment, the schools, the campuses are closed, but some of them are being used as vaccination centers.
I see. And speaking about vaccination, Professor Cleopas, authorities there have granted the green light to the Pfizer vaccine for those aged between 12 and 15. But I hear there is some public reservation regarding this allowance. Could you explain to us a bit about the public sentiment with regard to vaccination for children in the Philippines?
Well, there are still, the vaccination issue in the Philippines is a bit politicized, and at the same time, there's still a lot of the vaccination that is not coming to the population. But in terms of being able to continue schooling despite having those vaccinations already coming in at a gradual pace, I think the parents and some of the teachers have mixed responses in relation to going face-to-face classes. Actually, in 2020, in December, the Department of Education had pronounced that we are going to do some pilot implementation of the F2F if in some schools where the quarantine is lower and the virus transmission is lower. However, journalistic reports say that there are some reservations from parents and teachers, specifically because of the fear of getting their children and probably their families when they get home infected as well.
I see. All right, Professor Cleophas, thank you very much for making the time to join us live at this particular hour with your thoughts.
Thank you very much for inviting me.
Right, Professor Che, staying with the debate on vaccinating children against COVID-19, where do you stand?
So, so far, we have the age limit down to 12 years. That was lower from the 17 years. And we are expecting even lower, down to 2 years in the US and some places in Canada and Europe. So we are seeing the data from our other vaccine platforms as well. So we have this good clinical data that supports the effectiveness or the safety of the vaccines for the children at this point. So we do have this from the medical standpoint, we do have this additional benefit from the vaccinating children, also by bringing the additional protection to the vulnerable people like the grandpas or grandmas. So those are from our standpoint, but nothing is confirmatory yet. So studies are on the way. So I think we should probably get updated from the upcoming clinical trials and the field trial data.
Right, and against that backdrop, again, Professor Berry, I ask you the same question. Are the gains of COVID-19 inoculation greater than the risks of the disease itself for children?
Yes, I believe so. Children can still be infected with this virus. For many reasons, they have a milder disease, but they can still spread it to others. So, children are so important to us. They're a blessing, they're our future. Why should we not protect them with the vaccine? In Australia, we have only just rolled out eligibility of vaccine for those who are 30 years of age and above. We still have to do our cohort of 16 to 39 or 29, and then those younger than 12. So we have a very slow rollout of vaccination in Australia, probably because we are quite hesitant and we are very comfortable.
Right. Professor Che, I understand research shows, though, there is no dramatic decline in infections among children after vaccination. Correct. What are your thoughts on this?
So the calculating the vaccine effectiveness is actually just from the simple mathematics by subtracting the proportion of who got the disease from among the unvaccinated minus who got the disease among the vaccinated. So it is simple math. But in the real world, usually follows the multiple equations. Like for instance, as a baseline, the adults have a much higher disease burden compared to the children. That's why, so we see a greatest impact from the adult population. Children, on the other hand, has a lower disease incidence compared to adults, and we see a much lower impact from the vaccines. Also, not to mention that the children also have a very good vaccine immunogenicity and effectiveness data just as the adults from the clinical trials.
Oh, I see. Meanwhile, Professor Berry, what are some existing variables that may threaten efforts to contain COVID-19 within the academic arena and beyond?
Well, obviously it would be community spillover, and in particular those dangerous Indian variants that are much more virulent and highly transmissible. So we have some trouble in Victoria, in the state of Victoria in Australia at the moment, where we have the Delta and also the Kappa strain in the community. And this has actually seen a lot of Australians lift their game and roll up their sleeves to get vaccinated, which is a good thing.
That's quite encouraging to know. Professor Che, what do you propose to boost inoculation among members of the student body and the school staff as their turn comes around, I believe, next month?
So I think it is important to share the good scientific message to the general people with a transparent and very timely message that has to be passed on. And we understand that all the students and the teachers have to have the informed decision making with the public agencies and doctors. And this will probably benefit not just themselves, but also their beloved ones, like their families and the vulnerable close neighbors. So I think it is very critical to address these issues in a very concerted way.
All right. Professor Che, thank you very much for your thoughts. And Professor Barry, over in Australia, thank you very much for being with us at this hour.
Thank you very much, Sunny.
Right now, while the resumption of learning within school grounds takes us one step closer to normality, it is essential to abide by prevention measures to maintain it. Thank you for watching.